After you have selected your plastic surgeon, then you will coordinate your time frame with the coordinator and plan your flights and hotel stay. The coordinator will arrange, and they usually get a discount, at hotels. So it's best to let them book the hotel. My discount where I'm staying is significant. I'm paying like $123 a night, and the hotel is like $270. So it's a huge discount. But I'm also staying here for almost 2 weeks. So I would definitely talk to the coordinator. The bigger clinics, they all have contracts with different hotels. Also, at the hotels, you're not really going to feel weird. Like where I am staying, I would say at least 50%, if not more, of the people here are having dental work. I haven't seen too many people with looking like me, but I also know from my plastic surgeon, he has 2 other patients here that had liposuction. And, you can't see that. I'm like visibly obvious, had face surgery. So there's you also kind of being here for a while, you make friends. Everyone's talking about their teeth, their procedures, about how great Turkey is. You kind of become part of the medical tourism club. So then you will schedule a date for your surgery and then book your flights. And your flight will be, a few days, I don't know, maybe 4 days before. If you want to do some sightseeing, I would say come like a week before the surgery, because after the surgery, you're not really going to do that much. I mean, there are tours, but like most in Antalya, I'm not sure if this is true for Istanbul, but in Antalya, the tours are like 12 hours. So I'm up for doing like a 2-hour tour or a half a day tour, but I definitely do not want to be on a bus with people for 12 hours. So I would say, if you want to do some sightseeing, come a little earlier. And then after the surgery, I would plan on staying at least 10 days. I'm at day 6, so but when I leave, it'll be 10 days. And he said, I'm fine. He said, you could even leave today. But it's better, I think, just to be cautious, and you want to feel comfortable. And then, so once you're home, it's not like it ends, right? They're going to follow up. I have to send them pictures. They want to check the scars, make sure everything is still looking good. I have medications that start at various times. One will start a few days after I'm home. And then there's another one that starts 2 weeks later. So you're going to be in touch with them, following up with them for, a good month, and, probably for several months, but at least for a month. Now the surgery itself, you'll go to the hospital for a pre-op testing, which includes an EKG, a blood test, and a chest x-ray. And they'll already have a list of all of the medications that you're taking. You cannot take ibuprofen or aspirin before the surgery. They'll give you a list of things that you can't do before the surgery and the time frame. And then, the list of the medications that you'll take afterward. After the pre-op testing, it will be, a couple days before your surgery. And then I stayed in the hospital for 2 nights. He said it would be either 1 or 2 nights. I had drains, these tubes that were draining behind my ears. So I stayed in the hospital for that. And then I came home and I still had the drain on the 3rd day. So It's hard to plan really to do anything because you have to go back and forth to the doctor. On the third day, I did go back to the doctor and he removed the drains. Now on the sixth day, I went back and he removed the stitches. And then I'm going back on Wednesday for like a final check. And then, he applies some cream and things like that. And just your final like instructions so you know what to do when you go home.